Powell River had and probably still has a number of residents who do not have access to either a family physician or a nurse practitioner. So locally in 2013, we started to have conversation with our partners, mainly Vancouver Coastal Health, to look at local solutions to be able to increase our capacity. And this is where we saw basically two pieces of a puzzle. And one of them was a nurse practitioner at the Powell River Hospital who was in a primary care clinic. And then the other one was physicians in their own clinic who were looking at working with other healthcare professionals to be able to increase access to primary care.
Having colleagues in a practice, in a group practice, whether physicians or nurse practitioners, is always really valuable because you get different perspectives. I think a lot of us really appreciate the opportunity to build more team-based care. You see that in hospitals, and we get to do it there, but in our practices, we're really more isolated, and I think having integrating clinics with NPs and family practitioners and maybe even other health professionals as well, we have the opportunity to really broaden our scope and try and find the best fit for the patient and the problem that they come in with at any given time.
When I first started my NP position, the clinic it got bigger and bigger, and there was more attachment to the NP, and it became overwhelming with the amount of clerical work that was involved. And by moving here, I've been able to increase my job satisfaction for sure. The fact that I have Barb and Connie and Carol, who are our MOAs here at Family Tree Health, and they have taken a lot of that clerical burden. Also, being able to have GP mentors and be able to have a colleague to bounce ideas off of has been a huge positive for moving here to Family Tree Health.
What we wanted to do was to be able to screen patients that were coming in to emerge that were unattached, and then attach them to the nurse practitioner based on specific criteria.
Personally, I find it really helpful if I'm working in an emergency room. There's someone without a family doctor that has really complex needs, and it's really exciting for both me and for the patient to be able to have a conversation, say, I have a name for someone that you can follow up with and to do your primary care, and her name's Erin, and she's a nurse practitioner, and it's a great way to end my part in the emerge and to start a primary care chapter for them.
I think one of the challenges that I remember very clearly, it has to do with role differentiation or role clarification. What does a nurse practitioner do, and how is she different from a GP? I think the physicians were asking themselves that question. I think the patients were asking themselves that question, because it's still a relatively new professional role within the healthcare system.
Basically what we had to do is to come up with a legal contract between those two entities in order to do the relocation, and that was quite unexpected, but definitely took longer. And some issues that we face around this contract was issues around privacy and exchange of information.
One of the biggest challenges has been financial. We have a sort of private business model and a salary model, and trying to integrate those in a clinic, that's probably been the biggest challenge, certainly not unsurmountable.
The pilot was really successful in what it was supposed to achieve, and I think the success is really tied to the trust and the commitment that all the people involved were able to be part of.